Hello, this is Dr. MacDonald from South Side Chiropractic. Today I'm going to talk a little bit about migraines. In my practice recently, I've been seeing a lot more practice members or patients coming in with migraines. And what we found is, yes, they do need to get their neck checked because often a lot of the nerves that come out of the upper neck go back up into the head and those can initiate headaches. But also, sometimes we can get a little bit of a jamming with the joints actually in your cranial bones. So if you look at a skull, it's like one round circle. However, if you look really closely, there's these little lines called fissures, and they're like the plates of the earth. And there is just a slight movement between those two. And what we can do is when we're going through the spine, we can actually move the skull back and forth a little bit, and the fascia or the scalp should have some equal movement back and forth. If it's not, it's almost like it's almost like saran wrap that gets torqued on top of the skull. And many patients will notice that because when they get their migraines, it's actually really tender to touch in the skull. And sometimes they'll even like, it feels better if I put pressure in here. And one of the bones, which I find is really interesting, is called the temporal bone. And the temporal bone is really interesting because it houses your inner ear canal, your outer ear canal, the middle ear canal. There's a bunch of cranial nerves that come out of this area. It also helps to make up the TMJ. So often if we have problems in that area, there's lots of tension in there. That will also affect our TMJ as well. And so when we work on this, we'll often notice that not only does those headaches, because when we work with migraines, they don't usually just go away, but often what they do is they start to decrease their intensity and then decrease their frequency over time. Many people do find that their migraines go away. We never guarantee that because we never know for sure. But I just wanted to just mention that because a lot of patients don't really realize that we can actually work on those individual bones in the scalp. It's called cranial work. So if you know anybody or yourself, actually, I've had practice members before that have been experiencing headaches and they haven't told me because they thought the chiropractic is just about your spine. So if you have anyone who's suffering from those migraines, which can be debilitating, please reach out, book an appointment just to see if we can help you. Have a great day. Dr. Don from South Side Chiropractic.